see. I'm going to be moving back and forth. I'm actually going to be active, moving back and forth from my slides, I think. So I'm Janet Venturino, and I'm here because Kaiser Permanente, the company that I work with, a couple of years ago in 2007, decided to do something disruptive and unusual for us. We created a video game. It's called The Incredible Adventures of the Amazing Food Detective. And this game really is designed to leverage Kaiser Permanente's pretty extensive pediatric expertise and teach children ages 9 to 10 better habits around healthy eating and active living. That was our goal. I'll tell you a little bit about the game. The way it works is users become junior amazing food detectives by following and solving the eating and exercise mysteries of 8 different multi-ethnic characters. As they solve a mystery, they're rewarded with 3 of some 24 arcade-like mini-games. They're a lot of fun, and again, they reinforce exercise and eating right. They also have access to downloadable, printable activities like a scavenger hunt or recipes that have been developed by a Kaiser Permanente physician that they can go and they can cook. So things to get them back away from the computer. With all the criticism associated with TV and computer overuse, especially in this age group, you might wonder, why did we develop a video game? We recognize the contradiction, and we also very much recognize and follow the recommendations of the American Academy of Pediatrics, which is no more than 1 to 2 hours of game time, screen time a day. And yet we wanted to reach these kids where they are, and they're on computers. So we developed this game to really engage with them, but it automatically shuts off after 20 minutes. And it instructs them to go out and do something active. And it reinforces that by actually locking the game for 60 minutes. So they can't play it. They can't cheat and play. They need to go out and do something active. So we recognize the contradiction, and yet we think this is a great way to reach kids, and it turns out it is. We teamed up with Scholastic Incorporated and distributed some 10,000 packets of the game on a CD and teaching materials in classroom and send home materials to public schools across the country, 5,000 public schools, and asked them to work this into their curriculum. And they did. And we were very impressed with the results. 6 months after the launch, we estimate that around 230,000 kids of this age downloaded the game for free, which by the way is on our website, or watched it and played it in a classroom, and really kind of got into the whole activity of, and played, and even better, teachers told us, in a survey we included in the packet, teachers told us, 80% of them said they really thought the game was fun and useful, but more important, once they worked it into their curriculum, they noticed that their students were actually exhibiting better eating habits, bringing fruits and vegetables to lunch, and after playing the game, going out and doing something active. So they saw some immediate and some sustained behavior change in these kids. So we were pretty pleased about that. In fact, I have I just wanted to read this letter from a teacher out in the Northwest. She says that I was testing this new this program in the curriculum, and one of my students was on a Kaiser Permanente site and played the game for 20 minutes, and it kicked her off. It sent her out to get exercise. That is fantastic. The student was having a great time on the site, and then went out and did our pedestrian program for the next half hour, the best of both worlds. So we got some anecdotal and some good feedback that the game was working the way we had intended it to. The Amazing Food Detective really was an experiment for us, a disruptive, if you will, experiment, but it really builds on Kaiser Permanente's already pretty robust focus in the community around healthy eating and active living, combating obesity, everything from our grants, community partnerships. We have farmers markets in every one of the areas in which we serve. So this was really an interesting way to integrate gaming and fun into, and really reach that 9 to 10-year-old who we really believe is just forming those personalities, those habits that they will have for life. It's an age just before the whole the teenage and young adult distractions where helping them form some healthy habits actually can help them avoid obesity. So, if you're not familiar with Kaiser Permanente, it's just a few facts about us. We have been around for more than 60 years. We have more than 8.5 million members. We are an integrated model, closed. It is true, we are a closed integrated model, and we really are committed to total health. We operate in 9 states, including the DC area, and have a pretty extensive research program within our system. So, thank you.